Today on Soma Says, I'm joined by Dr. Krystal Couture, DPT, LAC, a holistic physical therapist and acupuncturist whose work weaves science with soul. Krystal is a gifted healer and spiritual teacher devoted to conscious, inside-out healing. She blends 5-element acupuncture, advanced pelvic floor dry needling, craniosacral, and somato-emotional release, osteopathic manipulation, and resistance flexibility to help patients restore harmony in body, mind, spirit, and emotions. She's a Reiki master, trained in Chinese nutrition and peri-steam hydrotherapy, and is currently completing her doctorate of acupuncture. She champions the idea that you are uniquely designed to heal. Krystal, welcome to Soma Says.
First off, Soma, thank you so much for having me. And thank you for being an MD who's out there sharing about pelvic health with clients, because not everyone is doing that. So thank you for being at the forefront. That's so important because very often you're in the front line. And when clients come to someone like me, it's very often that it's a last resort. They've tried everything. It's been years and years that they've had the dysfunction. So the sooner someone is getting into a therapeutic environment, the better. Let's talk about symptoms. So, the first that you mentioned, and perhaps the most common, is going to be urinary incontinence. But with that also comes urinary frequency, urinary retention, and difficulty with emptying fully. So there's a lot of components to the urinary aspect. There's also those components that are associated with the bowel that people don't always consider are related to the pelvic floor as well. So we can actually have incontinence of bowel. We can actually have retention of stool. And those can be so deeply connected to what's happening within the pelvic floor. And then, of course, as you mentioned, sexual dysfunction, which can be pain with penetration. It can be unable to tolerate any type of penetration. It can be pain at rest. It can be inability to achieve an orgasm, right? There are so many things going on. And then if we go deeper into the world of menstruation and menopause and everything that the hormones have going on, pelvic floor is just so related to the totality of what we call in Chinese medicine, the lower jiao, which is essentially from the belly button down to the base of the pelvis. So all the things that can happen in that region.
Can you explain what happens to our pelvis? Perhaps is it an overworking muscle or an underworking muscle, or is it a nerve issue? Can you explain to our audience, for example, what happens with urinary incontinence and frequency, as you were mentioning?
Yeah, for sure. So it can be an overworking of the muscles, so they can be too tight. It can also be, and this is the common misnomer, this is what most sort of people think is what's going on, is that everything down there just gets weak. So that can happen. There can be a weakness issue, but that's not always the case. It can also be a nerve issue. So if there's trauma, or if someone birth trauma as well, or if someone sits for a long time, or I've had a client who always keeps their chapstick in their back pocket and is sitting on it, right? So things like that can also lead to some nervous system dysfunction. So there can be a wide range of tightness, weakness, nerve problems, and let's add to that emotional issues, right? Which could be trauma. It could also be micro traumas. So there are many different ways in which pelvic floor dysfunction as an umbrella term can come to exist. And the problem is that if someone is not seeing a specialist or they're not talking to a specialist, then the sort of roundabout answer is, oh, just do kegels, it's fine. And that really doesn't work because we don't know what the intricacy of the dysfunction is, and being able to diagnose that and spend time with that, helping the client to understand these patterns that are going through their body or their emotions is key to moving forward.
I often find, and I include myself in this category as well, is that women don't often know how to do kegels properly. It's actually quite difficult to do. It's not an easy exercise.
It's not. And people are also misinformed. So I just want to say that kegel is not stopping your urine stream midway through. I don't know where that came from, but it's just bad advice. So what I teach my clients, and we can do this if that's okay with you, this is spontaneous, but do a quick little meditation to connect in with the pelvic floor. So if we have our feet grounded down to the earth, like feet on the floor, and we get our posture upright, connecting our crown up to the heavens, expanding our sides out wide. And then if we rock around in our seat a little bit, we start to feel like the tip of the tailbone, the sacrum, and we start to feel the bone in the front. That's the pubis. And if we rock a little bit side to side, we can feel the two sit bones or the ischial tuberosities. Now together, these make a kite-like shape. And within that kite-like shape is where the pelvic floor exists. It's like a beautiful hammock. That beautiful hammock is going to support our organs. It's going to help us with our sexual and reproductive function. And it's also going to support continence and optimal bladder and bowel function, right? So that's the pelvic floor. So I just encourage people to feel into that pelvic floor, feel into that space between those two sit bones, between the pubis and the tailbone. If we take an inhale, I want to feel that space relax. So that means it expands like a balloon on the inhale. And as we take an exhale, we can squeeze up in that area. So it pulls away from our seat and that diamond becomes a little bit closer together on that exhale. And then we inhale and everything relaxes and we feel like a balloon. It's like belly breathing, except we're taking it one step further down to the pelvic floor. And now we squeeze up and in, bringing that structure closer together again, abdomen to the spine, exhale, pushing out. And one more. On that inhale, filling that space, allowing that diamond-like structure to fill with air, fill with the breath, fill with the energy of healing. And then on that exhale, we're squeezing up and in, pushing that breath out from the pelvis, through the abdomen, squeezing the belly to the spine, and out through the nose or mouth. And so as people get into this pelvic breath, we start to realize a couple of things. One is we may not have the sensation that we think we do in our pelvic floor. Number two, we might realize that our breathing is upside down. We might realize that on the exhale, we are actually relaxing the pelvic floor. On the exhale, if we're relaxing, let's just logically put this together for a second. If we exhale and our pelvic floor is relaxed during that time, what's going to happen if we've got a full bladder? We're going to leak, right? So the pelvic breath, I actually prefer to Kegels because it helps to recalibrate the pelvic floor in alignment with the breath for proper pressure, because the abdomen is a pressure gradient, right? If we think about lifting something, we have to squeeze the abdomen, we have to squeeze the back. If we're not squeezing the pelvis, then everything just goes down. So it's part of that pressure gradient. And more than that, it also serves as a diaphragm. So people get into this concept of the respiratory diaphragm, then we have the pelvic diaphragm. And we want that sort of expansion, contractibility to be in synchronicity rather than opposition. Hopefully that makes sense for the
yes.
Yeah.
I'm actually going to, when this podcast is produced, I'm going to go back to that, to what you just said, and make sure that I do it.
It's actually like the number one thing that I give to all of my pelvic health clients, because maybe they're not ready for an internal exam when they see me. Maybe they're not ready to get needles. There could be a wide range of stuff that's going on. And whether or not they have a pelvis that's tight, that's weak, that has some type of nerve pathology, the pelvic breath is a safe way for them to begin. So it's like my top exercise, and it's my favorite. So I recommend everyone do it, and just 3 breaths in the morning each day, and you'll start to notice some changes. You'll start to notice more awareness. You'll start to notice more conscious breath throughout the day as well.
Okay. If it's okay, I'm going to share this with my patients as well, who are hopefully listening and watching. And yeah, if I have patients who are having these kind of issues, I'm going to definitely direct them to our podcast, because that is probably the most useful piece of information when it comes to pelvic floor dysfunction that I've learned. So thank you so much.
Pleasure.
You're both an acupuncturist and physical therapist. What led you to combine the two? Were you an acupuncturist first? Were you a physical therapist? later? How did that happen?
Yeah, honestly, I was a PT first, and I got into dry needling and pelvic health concomitantly around the same time. They were not combined as therapies at the same time, but I got into both of them at the same time and kind of by accident. And I really loved I really loved the medicine of inserting a needle. Like, it was so cool. It was very immediate to me that the response was more than a tissue response. I also will say, because there is a lot of adversity about dry needling between professions that exists out there, when I learned dry needling as a PT, it was not a weekend course. It was a fellowship. It was 2,000 hours. And so I spent a lot of time with it. Like, I really got to know the integration of that medicine. And then when that sort of drama happened between multiple fields, and for good reason, I got into a place where I didn't feel like I was in integrity with the medicine that I wanted to be in. So I went back to acupuncture school. And up to this point, I had started to really get to know Chinese medicine through the perspective of acupuncture because, the points in the body were talking to me. Like, they were it was clear that there was more to the system than just a muscle twitch and better muscle contractibility and elasticity. There was much more than the trigger point response that I was experiencing with my clients and my own self. So I wanted to know more about that. I really wanted to get into the spiritual emotional aspect of what acupuncture provides. And concomitantly, I was seeing pelvic health clients. Again, before it was cool, clients were just coming in with a shoulder thing. And then they were like, hey, I really trust you. I feel safe with you. I have this thing that's going on and no one knows what it is. Can we talk about this? Like, why is sex painful? It's okay. I don't know either, but let's find out. Let's explore this. So as that was evolving and as I was getting into how do we rehab this from a traditional perspective, I was very consciously aware that there was an aspect that was missing. And that was that there is so often an emotional or spiritual component associated with pelvic health dysfunction. No matter how many exercises I can give you, no matter how good my needling skills are for the pelvic floor, if we don't address the emotional issue, like if that's the root cause, then there's no way that this dysfunction is going to be remedied. It's going to come back. And so that was really important. And that was part of both of those things were catalysts for me to go to acupuncture school to bring in this missing piece. As acupuncturists, we are perfectly positioned to treat the pelvis. We understand biomedicine. We understand the organ systems of the body from both a Western and an Eastern energetic perspective. And we can get into this spiritual emotional aspect without going really deep into kind of the trauma, because the needles take the edge off of trauma, which is one of the cool things about it. So it was like, I have to do this. And not only do I have to do this, then it became, I have to teach this.
So you also teach acupuncture?
Specifically, I teach pelvic health to acupuncturists.
As you were talking, you were mentioning that some of your patients who were coming in for other issues, like shoulder issues, would then develop a trust with you and feel safe to talk about their pelvic health. Why do you think that there is still a taboo when it comes to discussing pelvic issues, incontinence, sexual dysfunction? And what are the barriers in openly talking about them?
Oh my gosh, that is such a good question. So I think there are a number of barriers, right? I think there is an overall shame that is associated with, in our Western culture, to some degree, about talking about sexual dysfunction, talking about reproductive dysfunction. And I think, honestly, it comes from us not knowing how to, as practitioners, not knowing how to talk about this in a way that has education, knowledge, and support. And I think it's becoming much less than it was. We also must remember, right? And this is not to get on another soapbox, but this is going back. Medicine really began with men. And the doctors were men. The women were very often witches or some other strange terminology that was associated, even though they were practicing medicine to some degree. And then if we think about religious and cultural preferences and rules and regulations, for lack of better terminology, I think it's a topic that has been set aside. And that's unfortunate because I think we're all here from a spiritual perspective. I think we're here to be our best selves, and being able to talk vulnerably about what plagues us is an important part for our development. And it's an important part for us to be able to fully experience life. Leaks are not normal. Stool retention is not normal. Pain with intercourse is not normal. They're common, but they're not normal. And so we've funneled this into, it was inappropriate at some time to talk about, period. And now we're starting to talk about it, but there's still not a lot of research. There's still not a lot of data, and there's still not a lot of education. Just now, I feel like just in recent years, are moms really starting to talk about menstruation with their young girls. And I'm like, this is wonderful. Like, we need more of this. How can we put this out there? Because this is a starting point. And would we have less pelvic dysfunction if we perhaps, as women, understood what was going on in our bodies from the get-go?
Yeah.
And I think we would. I think education is so important.
It is definitely important. And I find that whether it's doctors, nurse practitioners, and then patients themselves, right? The pelvic health gets ignored for women up until perhaps they start having issues, or it's right after childbirth or surgery. But often these things show up not necessarily knocking at your door. It's very subtle. And as we were discussing, women in general may not be comfortable bringing it up right away. So what I see, I'm an internist, so I see adult patients. In my older patients, I often find that it can cause older women, to not want to go outside. So perhaps they're not socializing as much. They feel like they might have a bladder leak, and obviously that would be embarrassing. In other ways, how do you find that these kind of issues affect women when it comes to the rest of their lives? What do you see?
I think the social piece is one of the biggest pieces, especially in that postmenopausal. There are actually so many studies. The studies that are done on pelvic health, most of them, this is good and bad, most of them are done in regards to quality of life. And so that's amazing, because that gives us some real insight into what people are experiencing. It doesn't give us a lot in the meat of the treatment and how do we get to the root of the problem, but it does say, what to these clients, what you're experiencing is real. Other women are experiencing this too. And this is impacting your mental health in a significant way. So what they found the most commonly is that there's that stay inside mentality, so that they're not going out, they're not socializing. And that obviously leads to increased risk of depression. They found, believe it or not, that while that was number 2, so the incontinence in the elderly, what was the most challenging for mental health was actually prolapse postpartum.
Okay.
And so there was a huge correlation with either uterine or bladder or even rectal prolapse postpartum and postpartum depression. People feel shame. People feel uncertain. They don't know if their bladder is going to fall out. They don't know if they're going to have leaks. They don't know if this is going to smell. They don't know if they're going to be able to deal with this, especially if they've got a toddler in tow or a card game that they're into. So people's quality of life is severely impacted. And if you're listening to this and you're one of someone's clients, you know that these things are impacting you. You're stopping doing the things that you love, whatever those are. And that's sad. And while it's common, it's not normal. And there are people out there that can help you.
You gave us a little bit of how you treat pelvic issues, but tell us how your method, and I can imagine, but it would be nice to hear from you, how your method of treating pelvic health issues differ from the traditional treatments that are out there.
Yeah, for sure. Things changing a little bit. companies that develop products have realized that pelvic health is an issue. So right now, it's an interesting perspective because there are so many like things that you can buy that help, in quotes, with pelvic health. Many of them, I don't know if they help with pelvic health or not, but there are so many things out there. And I think that's important to say because there's, oh, buy this thing from Amazon and maybe it'll work. And there's traditional PT route and there's alternative practitioners like myself. So there's multiple routes that you can go. What I think is so important about finding someone who really specializes in the emotional as well as the physical component is key. Because what I do specifically, and the way that I teach this is to create a foundation, right? If we don't have a foundation for treatment, then we're not going to have longevity of treatment. And that's something acupuncture does really well because it treats the source of the dysfunction. So we create a foundation. Then we work with the tissue imbalances. So whatever those are. So if we have a pelvis that is tilted, or we have a sacrum that is on a torsion or something of that sort, right? We want to work with those structural issues and work with the fascia and the muscles that are supporting or creating that dysfunction. As we layer that in, we can start to tonify the bladder, right? Wake up the bladder so that the bladder is in its state, if it's a bladder dysfunction, is in its state where it's in optimal health. If the bladder has damp heat, we need to be able to clear that, right? And that's something that acupuncture and herbs does really well. Traditional physio doesn't get to that space because it just doesn't have the methodology for it. And then we work with the spirit and the emotions. And this is just a layering, right? So it could be that the spirit and the emotions are on top, and someone in the first session might say, hey, I've never told anyone this, but I was sexually abused when I was 13. And it's okay. So we're going to lay a foundation and we're going to start with that before we go anywhere else because that's what's on top. So the sort of order of it and the layering of it, there's a poetry to that. And it really is meeting the client where they are. And if you're looking for a practitioner, if you're a client listening to this and you're looking for a practitioner, I think it's important that you find someone that seems like you can develop rapport with, develop relationship with over time, that you can trust, that has a methodology that speaks to what is important to you and definitely says something about sustainability. Because we don't want, and in my opinion, we don't want you to get better for 2 weeks or 3 months. We want you to have tools to go the long haul and not have to deal with whatever it is that's plaguing you.
So in terms of things like urinary incontinence, obviously, ones that don't require surgery.
Yes.
How long are women typically in treatment with you for things like that?
I would say it's usually like 10 to 12 visits. And that's dependent upon what's their time frame, what's happening. I like to keep those 10 to 12 visits within a 2 to 3 month range for sure, less if possible. But that's like the standard that we work with. In that time, we make big changes. And that's really awesome. Now, I have had clients. I have a woman, she has had 6 children, vaginal births, and she had a hysterectomy. So her uterus was removed and she had a really severe prolapse. She also had a whole host of other problems. So there was a concomitant constipation. So there was a tightness and a weakness that was filling this space. She was going through a huge transition in her life with someone very close to her who died. And so just lots and lots of things going on, right? Now, this is someone who she went through her initial protocol. We made a lot of progress and we continue to work together on a monthly or every 6 weeks basis for maintenance. But I would say she's an outlier. Most people, even the elderly population that has had urinary incontinence for 10, 15, 20 years, they tend to fit well into that 10 to 12 session sort of category.
Okay. All right. That's useful because a lot of women don't necessarily know how long treatment will go on for. And as everyone's busy, and so that's useful for them to understand that they should carve out a certain amount of time for their body to improve. There's so many myths, I feel, when it comes to pelvic health. What are some that you can share with us that you wish that every woman could unlearn?
Oh my gosh. There are so many. The first one is that Kegels are the answer to everything. I think we already touched on that. That would be myth number one. I would say myth number two is that while something might be common, it might not be normal. And so pain, just simply talking, pain with menstruation, while it's common, it's not normal. We can have menstrual cycles without pain. We don't have to. Another one that's big is urinary incontinence is part of the aging process and it's normal. No, it is not normal. No, it is not part of the process. While our hormones are changing, if we're paying attention to our bodies and we're doing the pelvic breath, you don't even have to see me if you're doing that. You're just going to be able to see improvements just by doing the pelvic breath. So this is not something we have to live with. And I think so many of these myths come from us being disconnected from our bodies and us being too busy with life to pay attention to our bodies.
What are some other ways you shared an exercise with us in the beginning? What are some other ways that women can reconnect with their bodies again, especially as you were mentioning, if they've experienced shame or trauma with their bodies?
Yeah. Yeah. I think the first thing is finding a way to honor your body. So if that's meditation and just placing your hands like thumbs in the belly button and then letting your hands go on that womb uterus area. If that's comfortable for you, if you can just lay your hands there and rest for 5 minutes without any stimulation, no phone, you can have music on or candle or something like that, really tuning out from the world, no children wanting something from you, just 5 minutes that are your own with your hands on your womb. I think that's another really simple way to get to the pelvis. Your body will talk to you, like it will give you messages. It'll say something's not right. It will say, I need your attention here if you're listening. I also really do love, like, as far as an exercise goes, if someone can tolerate it, there's two that I love. The first one is just like laying with your legs up the wall. So either on the floor or on the bed with your butt toward the headboard and your legs up the wall. I feel like that's a really nice way to end your day. It's really good for lymphatic flow, circulation. And there's obviously, we have a lot of fluid, right, in the pelvic bowl area between blood and water alone, right? There's so much going on. And then there's all this energy and all this chi. So I think that legs up the wall is great. It's another simple one. You can actually do my little meditation, hands on the womb, with your legs up the wall at the same time. Another one I like is just windshield wiper exercise with your legs. So you're laying either on the bed or the floor and you're just allowing with your feet, with your knees bent, you're just allowing your legs, your hips to rotate to one side, allowing them to rotate to the other side. That's a nice way to lubricate the hip joints, and it helps to get some awareness into the pelvic floor and give you some insight. Am I tighter on one side? Is something gripping or uncomfortable? So those are my very basic, very simple ways to tune into the pelvis.
Okay. All things that I'm visualizing as you were talking about it. And so I'm going to try to incorporate this into my routine if possible.
Good.
I wish you were closer to where I am. I would definitely come see you as a patient. And
Are you, Soma?
I'm in New Jersey.
Okay.
Yeah.
East Coast. We're not that far.
So, yeah, but everything you were saying, I'm going to try to incorporate into my routine to see if this helps. When patients come to see you, especially when it comes to pelvic health issues, what is the thing that they get most surprised about during their sessions with you?
I think that there is a natural anxiety around coming in for a pelvic health session. The female pelvic exam is like the most, according to research and recent research, is the most feared medical procedure. Just sit with that for a second. That's really big and that's really unfortunate. And if we look historically, there is so much data to back up the emotionality of why that is the case. But today, that's still what's happening. And so there's a cellular response to simply saying pelvic or pelvic exam. And I think what people find when they come to me and when they come to the practitioners that I've trained is that we try to take the edge off of the fear and try to just be there to hold space. And so often what I hear is, oh my gosh, this was really liberating, or this was really freeing. And I did feel safe to talk about this. So I think that the emotional hurdle is more challenging than what's there physically. And as providers, and I know you have providers that listen to this podcast too, as providers, if we can just take a step back and take a breath to just listen to our clients for a short moment, they're going to be on board with what we're offering if we're a good fit, because they want help. They're there. They showed up. That's the hardest step. They were vulnerable enough to show up, which means they want this help. And if we can just be open-hearted, compassionate, listen, and then share our knowledge, then share exactly what we're going to do in the way that we're going to do it, keep communicating with our clients and tell them they can revoke consent at any moment, they feel safe. We've put them in the seat of being the authority of their healthcare. While we might be the expert, they are the authority. And that is a game changer for working with pelvic health clients.
I think that's all across medicine, honestly. And I think right now, the way the state of medicine is that there isn't enough time because of the volume of patients that we're seeing. God knows how many other issues when it comes to a medical practice. Your practice itself, do you accept insurance? Are you cash-based only? How do you work? And why?
Yeah. So I think you're right. I do think this would be a great way to just approach every client. Yeah. So I'm a boutique practice. So I am a cash-based practice. I do not take insurance. I did. And I found that when I took insurance, it was really hard for myself and my staff to be in alignment. And the medicine that I practice in a cash-based practice is superior to what I could practice in an insurance-based practice. And that's unfortunate. I hate to say that, but the regulations are such that it makes it really difficult when you're not getting paid because insurance is holding this up for whatever reason, or they're putting this regulation in where you can't treat their spine and their pelvis concomitantly. But actually, and this is a good point for your clients, if you have back pain and your back pain is not getting resolved and you've done everything you can for your back, it actually might be coming from your pelvis. But back to the actual question, there's too many restrictions. And so I just found that to help people and to provide this service in the best way possible, insurance didn't make sense for me at that time. Maybe it will in the future, but for now it doesn't. And that does make me sad.
Then you get patients who obviously are able to pay you out of pocket, but it gives them the ability to have that time with you that they otherwise wouldn't have if they were using insurance. And I think that's spread across all of medicine.
Yeah.
It's interesting what's happening. It sounds like you have a particular niche where women seek you out. What are some of the other things that you see besides pelvic floor issues? Are there other conditions that you treat that you have a specialty in?
Yeah, for sure. I guess I want to just add a caveat. So I do see
Sure.
women. I also see men, pelvic health, and really all genders. But I think that while for the most part, there's a lot of research that's done in men's health, and men have been the forefront of everything, and women are trying to take power back in so many ways, and we absolutely need to. One area where it's even less talked about than it is for women is men's pelvic health dysfunction. And so I actually do see a lot of men as well that have a variety of pelvic health dysfunction. And so that tends to be a lot of my practice.
Okay.
I also see both women's health, men's health, fertility, and I still see, because this is where I started in orthopedics and sports medicine, I do still see a lot of orthopedic clients that are coming in. I hate to niche down. I feel like my niche is pelvic health. And if you're coming to see me for that, that's awesome. And otherwise, if we're a good fit, I'll treat most things that I have knowledge in. And I would say they live in the realm of women's health, men's health, and ortho.
Okay. And most of your clients, is it a 50-50 practice where it's men and women? or do you see more women versus men?
Yeah, I would say it's probably like a 70-30 women
Okay.
to men.
Okay. Yeah.
I think it takes a lot for a male to come in to see a woman for their pelvic health
Yeah.
dysfunction, but they do. And, I love all my clients. That's the great thing about the way that I practice is having that time and space to make sure that we're a good fit, make sure that I'm the practitioner that's going to help get you as far as I can. And so it works really well. I love the mix. I love the nature of it. And it's very fulfilling.
Krystal, we've learned so much from you. Where can we find your practice? And then on social media, your website, how can people look for you?
Yeah, sure. So my website is Krystal, Krystal -couture.com. On Instagram, I am Dr. Krystal Couture. So I'm pretty easy to find by name. My teaching website, if there is a provider that's listening that wants to learn more, I have a lot of free resources out there for providers as well. And then, of course, my classes. So I am thepelvicacu.com or thepelvicacu on Instagram.
Awesome. And as we wrap up, I wanted to know if your pelvic floor health philosophy was a mantra, what would it be?
I think it's that the pelvis is the root of our being.
Yeah, definitely is, especially for women, I think.
Yeah.
It's not something that I necessarily appreciated prior to motherhood and then going through other things related to women's health issues. But yeah, especially in your 20s, you think that you're invincible when it comes to these things. But with aging, then these things subtly start appearing and you don't really even necessarily know what's happening until it's there in full force. This was such an awesome podcast. I wish I could talk to you for 2 more hours. You are always welcome back on our podcast to talk about not just pelvic floor issues, but anything else that you would love to talk about when it comes to women's health. Thank you so much for your time.
This was wonderful. I really appreciate how you shared questions that were close to your own health and also close to the health that you're seeing in women on a daily basis, because that's the perfect platform for us to talk so openly and so intimately. So thank you so much for having me. And I really appreciate the work.